Welcome to Facts TV News, where everything is true. After great loss, family appeals to Jamaicans to take the vaccine.
It's not an easy road, you know. It's not an easy road. Because I never know this would reach us. I never know this would reach us. So family need to be more cautious as well. Just take the vaccine. Just take the vaccine.
If he did take the vaccine, I think he would live today. Just take the vaccine. Don't listen to the rumors and what is on Facebook or the media. Just take the vaccine. Don't hold back and say you're not taking it because it can save your life.
Nurse Henry is playing for a person to protect themselves from COVID-19.
Hey, I'm ART Henry, working for the University of West Indies, and I can tell you, we're out of space, staff are stretched, we're tired. We have persons coming here who are really not being able to breathe. Alright? We can't manage anymore. Oxygen is on a low. So people, please, really urging for you to stay at home, wear a mask, take precaution, and get vaccinated.
Tufton denies Pfizer vaccine expiration rumors. The Minister of Health and Wellness, Dr. Christopher Tufton, has denied rumors circulating that the Pfizer vaccines on the island will expire at midnight. Speaking to reporters at the Sandals Inn vaccination site in Montego Bay early Wednesday, Tufton noted that the expiry dates for the Pfizer vaccines on the island are in the coming months. The Pfizer vaccines have an expiration date that goes straight into the next few months, I think, so there is no issue there, Tufton said. While he did not provide an expiration date for the Pfizer vaccine, the minister, however, shared that a number of the AstraZeneca vaccines on the island will expire at the end of this month. We do have some AstraZeneca vaccines that will expire at the end of September, and so we are administering those, he said. Tufton again assured Jamaicans that expired vaccines will not be used. We are not administering any expired vaccine, so you do not have to worry about that, the minister affirmed. Tufton also shared that additional vaccines will be on the island later this week. There will be additional vaccines coming in later this week, more J&J, so we are not worrying about vaccine availability at this point, he added. Hospital's outpatient department relocated. Operations at the Mandeville Regional Hospital outpatient department will be located to the Mandeville Seventh-day Adventist Church Hall, 3A Caledonia Road, Mandeville, as of today, September 8. The Southern Regional Health Authority, in a notice yesterday, said all outpatient clinics, with the exception of the orthopedic clinic, will be relocated. The clinics will be open to the public Mondays to Fridays between the hours of 8 a.m. and 3 p.m. Patients will be allowed to park in the church parking lot. Where possible, patients are asked to utilize the National Health Fund Quick Prescribe Program and the Public-Private Partnership Program with partnering pharmacies to have their prescriptions filled. The participating pharmacies include Caledonia Mall, Hauntons and Germax pharmacies, said the health authority. The management of the hospital thanked the Mandeville Seventh-day Adventist Church for its partnership and support as the hospital manages the impact of the novel coronavirus pandemic. Jamaica to ramp up testing for COVID new strain, says Tufton. While yesterday's confirmation of the novel coronavirus new variant being detected in the Caribbean, Minister of Health and Wellness Dr. Christopher Tufton has announced that his ministry intends to ramp up its testing for the new strain. Now that we know that there is new variant in the Caribbean and it is one of concern, then we will pay particular attention to ensure that we not only test for Delta and others, but we also test for this particular one, he said. We continue to conduct surveillance on the virus, its spread and the type of variant that is in the population. As you know, we collect samples. We send samples to 3 sites out of Jamaica for those samples to be tested, Tufton told reporters during a vaccination tour in St. James. The health minister pointed out that the new variants of the virus are expected as the world has not achieved herd immunity. It is something that we expect. New variants will emerge particularly because the world has not reached majority vaccination and that is what gives rise to new variants emerging, Tufton stated. However, he noted the Ministry of Health and Wellness will continue to monitor and announce once confirmed. The Caribbean's first 5 cases of the new variant was announced in St. Vincent and the Grenadines. Ocean's 11 boss looking forward to more cruise ships. Forced to lay off about a third of his workforce at Ocean's 11 when COVID-19 upended the economy, former Member of Parliament for St. Ann Northeastern, Manny Bowen, is hoping last month's reopening of the cruise shipping industry mean better days are ahead. Before the onset of the virus, Ocean's 11, located beside the Ocherios cruise ship pier, had a vibrant nightlife and was an easy reach for cruise ship passengers. It comprises a gift shop, a liquor store, as well as a restaurant and bar. The liquor store and gift shop have been closed for 1.5 years. From March 18 last year, they have not been open, Bowen stated during an interview at his restaurant and bar, which remains open amid national restrictions and a significant cut in its customer base. While keeping the specifics of his company's financial health close to his chest, Bowen reasoned, if you lock a business for 1.5 years, it must be a problem. It must have created major financial challenges. You can't continue to pay workers if you're not earning. It has to come from somewhere. The sharp downturn in business is not particular to Ocean's 11. All of us are feeling the pinch, Bowen asserted. He said he has laid off more than 20 people of the 60 plus who work for him in Ocean's 11. We keep on more people than we need because we understand that they have families as well, the entrepreneur stated. We understand that every worker here is a part of my family. I understand their challenges, but it gets to a point where you can do so much and no more. He expressed optimism that the gradual reopening of the cruise ship industry will benefit its business in the resort town. The industry reopened on August 16 with Carnival Sunshine docking at Ocherios Pier. Between August and October, Ocherios will join cruise ports in Falmouth and Montego Bay in welcoming a combined total of 25 calls from Carnival Cruise Lines, Royal Caribbean International, and MSC Cruise. The government has steadily stressed that vaccination is the best way to achieve recovery both from the virus and economically, and the tourism minister last week launched a blitz to vaccinate the 170,000 workers in the industry. In the first 3 days, 2,000 industry workers got the jab. However, vaccine hesitancy is still very strong across the country. Bowen said he fully supports the vaccination process that may result in life going back to normal. You have idiots all over the place, he stated, in reference to those against the COVID-19 vaccine, adding that he already got his jab. I am not one of the anti-vaxxers. I have no desire to get in anywhere close to that kind of thinking. I much prefer to err on the side of science and professionals than on the side of the Obeahman. 20 more COVID deaths, 672 new cases. Jamaica recorded 672 new COVID-19 cases and 20 deaths on Tuesday, bringing the infection total to 73,496 and virus death toll to 1,666. The Ministry of Health and Wellness reported that the new cases comprised of 414 females and 258 males with ages ranging from 3 days to 101 years. The cases were recorded in Kingston and St. Andrew 95, St. Catherine 94, Manchester 93, St. Thomas 83, St. Elizabeth 73, St. James 54, Clarendon 45, Westmoreland 39, Portland 32, Trelawney 22, St. Mary 16, Hanover 15, and St. Anne 11. The latest deceased comprised of a 79-year-old male from St. Elizabeth, a 79-year-old female from Manchester, whose death was previously under investigation, a 65-year-old male from Manchester, a 58-year-old male from Manchester, a 58-year-old female from Manchester, a 59-year-old male from St. Anne, a 61-year-old female from St. Anne, a 77-year-old female from St. Anne, a 56-year-old female from St. Anne, a 61-year-old male from St. Anne, a 65-year-old female from St. Anne, a 77-year-old female from St. Anne, a 78-year-old female from St. Anne, a 78-year-old male from St. Anne, a 51-year-old male from St. Thomas, an 83-year-old female from St. Thomas, a 66-year-old female from Kingston and St. Andrew, a 72-year-old male from Kingston and St. Andrew, a 63-year-old female from St. Mary, and a 64-year-old male from St. Mary. Jamaica has 22,225 active cases after 90 people recovered from the virus, bringing the total number of recoveries to 49,135. Currently, 786 people are hospitalized, 122 of which are severely ill, while 50 are critically ill and 158 are moderately ill. Dr. Christopher Tufton and Dr. Maurice Guy meet to have a discussion on COVID-19 and vaccines.
So, Maurice, I follow social media a lot, and us Jamaicans.
I'm told you're the king.
Well, I am not, but nevertheless, I follow it because I think it's an important part of communicating. You know, our Jamaicans will always be cynical, and you and I are seen in Parliament every day at each other, exposing issues, critical of each other's suggestions. Healthy part of the democracy, but not everybody interprets it as that. They think that it means that we can't sit together. And I'm sure there are going to be some who sees this and say, I wonder why it is now that they think they need to come together. What's the conspiracy? What do they have to gain? Is it something personal? And I think we need to address it. I mean, for me, this is so important as a Jamaican for saving lives. But I have a duty as Minister of Health. And so this is my mandate, despite my own personal views. I'd like you to hear your views on why this is important. I think Jamaicans need to know that.
All right. I grew up in an era when I was going to high school and university, when everybody was going away. And people were asking me, why is it that you're not going away? I said, well, I'm Jamaican, and I'm going to be the last one to turn off the light. I am doing this today because I feel that this is the only way, the solution that Jamaica can be Jamaica. There is a view that the opposition has not been really supportive of the government in some respects. And certainly, I will not deny that that is so. We disagree on certain aspects of the management of the COVID pandemic, as I said before. But guess what? This is something that we both agree on. This is something that we feel passionate about. This is something that if you check the records, you will see that of all the vaccination sites, and if you follow social media, as has been said, that you will see this particular MP at the vaccination sites encouraging. Check the records and see how many are done at the vaccination sites in St. Mary, and then you'll have another picture to say, because it speaks to something that I feel passionate about. Something that I feel that our Jamaican people, Chris, should really feel the same way. We want to restore Jamaica back to Jamaica. There's no conspiracy. My one is born out of science. That's my profession. And I know from a scientific basis that vaccines will help. But politically, it is going to help because at the end of the day, it is Jamaica that we are fighting for. And I know that it is Jamaica who has given your government the opportunity to run this country you're fighting for as well. So on this note, ladies and gentlemen, our joint approach on vaccination today is nothing to be for one to think about a conspiracy. It is a genuine thing. It is something that is born out of a concern for what is happening in the country. And we want the deaths to be reduced. We want the hospitalizations to be reduced. We don't want the agony that we see happening and potentially can happen to continue.
Please remember to subscribe, like, share, and click the notification bell for daily updates.